everybody, and welcome back to another episode of The Male Perspective. I am your host, Lana Reid, and today on this day, I have the pleasure of sitting down with a gentleman by the name of Karter Grant. He's a licensed mental health counselor, a professor of psychology, and probably his most important role, he is a father. He's out here empowering, impacting the future generation, and I am looking forward to spending some time with him today and learning more about how he helps us keep our mental health in tip-top shape. But first and foremost, as I always do, I take a quick moment to pause, say thank you to you for making time for me today. Time is a gift. Once we give it, we cannot get it back. So I truly appreciate you setting aside this time to talk to little old me. And with that, sir, welcome to the show.
Thank you. Thank you for having me and reaching out.
Awesome. Well, let me jump right in because we have a short amount of time today, and I have a lot of stuff I want to try to unpack here. But the first thing I want to tackle is when it comes to mental health professionals, outsiders looking in tend to kind of dump all of you into the same bucket, and don't understand that. I guess in popular culture, the term is there's levels to this. And I see that one of your core areas that therapy methods that you use is solution based. And I think in other words, trauma focused. So could you explain, kind of unpack that for us and explain what that is and how that might differ from other mental health professionals?
Absolutely. So you're absolutely right. The mental health field is gigantic, and I think it's a good thing. There are many different levels of education required, different licensures. Each state may have their own requirements for licensure. I myself have a master's degree in mental health counseling, and I've had so many hours of clinical work under supervision. Then I sit for an exam, and then I'm independently licensed. That's the point where you can put up your shingle and have your own practice. Um, but even with each individual like type of a provider, like a psychologist, a mental health counselor, a licensed social worker, there are different approaches to counseling and clinical work. And the great thing is no one perspective is necessarily better than the other, but it depends on personality, people, I guess their own inclination and how they approach people, that they're going to feel more comfortable with one perspective or another. It also depends on the clients coming in to seek therapy. I always empower people to ask anybody if they're reaching out for therapy to ask them, what is your approach? What's your clinical approach? Because it's going to be very different. Maybe in pop TV and media, you might learn about the psychodynamic, where it's like Freud. You're talking about dream analysis, laying on a couch and talking about those kind of unconscious thoughts. But then there's more CBT. You see a lot of that in school-based clinical work where it makes the connection between your mind and your behaviors. And I myself, I'm a solution-focused brief therapist. Now, the reason where that differs, actually, it's relevant to say most people, when they first enter the field, are cognitive behavioral, right? The mind and behavior, right? Insurance companies love it because it's very simple to understand, very concrete. But when I started to work in the field, as a young clinician, I realized that a lot of these agencies that have therapists, there's a lot of clients tend to kind of be stagnant after some time, and you'll hear about people being in therapy for 3, 4, 5 years, and I always thought, like, what's taking place? Because every therapy has the goals in place, the timeline to reach those goals. But if someone's going to therapy for 3, 4, 5 years, I'm wondering what kind of progress is being made. So when I finally started my private practice, I'd already known about solution-focused speech therapy, but most agencies don't want that because they want people to keep coming back. Solution-focused brief therapy, the premise really is that everybody is inherently growth-seeking, and that people, no matter how much information you may give to a professional, the client, the person, they are the best decider of how to address and approach your problems. And it's not approach where you can just put a hat on and say, I'm a solution-focused therapist. You really have to believe that, You have to really believe that people have these inherent skills within themselves to get to the solution. And my role in that whole process is to, one, helping people to realize the victories they've already made even before they set foot for the first time in my office, and then to realize that the solutions are in the exceptions to the problem. And a very simple example is someone comes in and says, I'm never, ever happy. I may say, you're never happy? 100% of the time, you're always unhappy. Well, no, 85% of the time, I'm unhappy. Okay, I understand. Let's talk a little bit about that 50% when you are happy.
Mhm.
When they're in the exception to the problem, what is happening there? What are you doing? Who is around you? How are you sleeping? What your day is like? And you begin to realize that there are things we do right and things are going well, but then all the time we're not doing the right things that make us feel good and makes us healthy. Things are going really
Yeah.
bad, but we're so focused on the problem, not looking at
Mhm.
the solutions. So I really address it as with every single interaction, I assume it's the last time I'm going to see them. So I want every single interaction to be kind of empowering for them to get something out of it because if they never come back, they've gotten something from that session. So it's very targeted and it's
Okay.
especially helpful for people who've been in that rat race of going in therapy for years and years and years with no resolution.
No, I like that better because it does seem to be milking the system, so to speak, to have somebody keep on coming back for services year after year after year. But you mentioned something that brings me to my next question. The process of getting to somebody, because a lot of times we're going through this process of being a human being, having the human experience, and life is what it is, and we tell ourselves, well, I'll just drink a cup of tea and have a hot shower and maybe take a long walk. At what point do we say to ourselves, something else is going on here? I need to go find somebody to talk to.
Mm-hmm.
What should that, how does that work out?
Yeah, at first I'm in favor of having tea, going for that walk, meditating, singing, listening to music, all those things are great. I think when people realize that I'm not sure I'm capable right now in my current state to address or solve these issues, or my daily functioning has severely decreased. Where
Okay.
I was operating at this level, and now I'm over here, and I have no idea how to get back to over here. Now it's impacting my job, it's impacting my relationship, impacting my housing. So when it begins to have an impact, that's when we decide that we realize that there is something dysfunctional happening, is that it's negatively impacting your typical functioning.
Gotcha.
There are eccentric people that are kind of weird, wacky, funny, flighty, whatever, all those things, but they're able to maintain a happy life, go to work, have relationships. It's when those things begin to kind of diminish that we realize that something's going on. And therapy, talking to somebody is most helpful before the problem has become catastrophic, right?
Okay. And
So it,
everything's imploding,
Right,
right?
right. It's when the backslide begins, you can go and you can talk to somebody, either it's a therapist or clergy or a trusted person who knows has your best outcome in mind. It's most effective before you reach rock bottom, when
Oh.
things seem so dire, because at that point, the odds of you picking up the phone, odds of you driving to the office, odds of you walking in is very low because you're at the rock bottom. So it's really when you still have some energy and some hope that
Okay.
you seek out help.
Okay. Okay. Now, let me ask you this, because we're living in a world today, I mean, it's kind of a blessing and a curse where all of us have these things. Um, and it might be the inclination for somebody to, Google search or Instagram posts and kind of self-diagnose themselves or the people around them. Can you speak to the dangers in that?
Yeah. Well, I say, technology is a blessing and a curse, you're right? Especially because of COVID, right? A lot of people were not able to leave the house to seek help, but now technology has opened it up for telehealth, virtual sessions. And
Yeah.
though I don't think it's optimal as opposed to sitting across from somebody in the room, but the people wouldn't otherwise leave their front door to go get help, it gives them something, you know. But in terms of, going to Google, Wikipedia, thinking that I remember in grad school when I learned about all these diagnoses, I had every single one. I'm learning about this. I'm like, oh my God, this is me.
I know, right?
Every single student, and that kind of highlights how we all have things, we have features of different stuff, but it's not to the point where our functioning is diminished, right? Uh,
Mhm.
and I think knowing or having an idea as to what's going on is just one small step. Really, it's having kind of collecting all the resources to begin to address it and to change things and to fight it and to improve. That's the real work. You can say, Kenzie, you are, Carter, you're depressed, you know, and I say, okay, I got it, I'm depressed. Great. But I need to kind of gather my reserves to kind of begin to do something about it. And that's when it could help to have a partner. If you think of a trainer, you need help to motivate and
Oh,
to figure out what am I missing? I can think walking, 5 days a week is helpful, but they may say, yeah, but you're missing your diet, you're missing stretching, you're missing your ab work. So
mm,
having that extra person to help you address a problem that you may think you have.
Awesome. Well, let me ask you this as well, because a lot of times we hear the flip side of the question. So I'm going to turn it around. We often hear how to find a good mental health professional for you. But when a client steps into your office, are there ever instances where you say, I don't think I'm a good fit for you? We're not a good team together. Does that ever happen?
So the benefit of being in private practice, right? I don't work for an agency or for somebody else. I work for myself. I'm able to be honest in the initial
Okay.
screening part.
Okay.
In a big agency with as many clinicians, you may be able to get able to get in sooner because they have many different therapists. Some of them may be pre-licensed, right? They're learning, they're getting their hours to get them to become independently licensed. But they're gonna take everybody in, right? The intake phone number is gonna say, yes, I'll schedule you, come on in. They may ask a little bit about what's going on, but they'll bring you in. In my clinical practice, I do a screening, and it's not just to say, oh, I don't want the hard people. No, I talk to the person and say, this is my approach, and this is how the session is going to go. And I explain to them how I think it may help them in the problem they're bringing to me. And then we decide if they think it's a good fit at that very early stage.
Okay.
And that so that they have a good understanding as to what my approach is, where I'm coming from. And then when we meet, we then again look at that process and learn more about what's bringing them in to see how I can help. So, and I have been able to say, you know what, it doesn't sound like I'm the right person for you because you need, XYZ before this super important trip, or you need this screening so you can go to this job. And it's like, well, that's not exactly what I do. So I can refer you to somebody else who might be able to help you. So I can be
Awesome.
selective and be honest in that sense, where I'm only going to take clients that I really believe that I can help them.
Awesome. I like that. Okay. Now, I saw another thing that you do is couple counseling, and kudos to you.
Thank
Kudos
you.
to you. But one of the things that I have heard year after year when it comes to couple counseling is the scenario is where one half wants to go, one half is
Mm,
advocating for it, and the other half is kicking and screaming and I don't want to go. And they show up just because the other person wants them to. How do you get effective sessions when it's only one person that really wants to be
right.
there?
Right. I'll tell you, I haven't actually, to this point, I haven't yet met a couple who both couples both agreed. It's always one person bringing the other person in.
Mm-hmm.
And most often the person that is reluctant to come in, it's because they either have heard negative things about therapy. Maybe the only thing they know about therapy is what they see on TV, which it always pains me. Whenever I see a therapist on a movie or TV show, I'm like, oh my God, it's so unethical. So the boundaries are horrible. So it looks really bad. Or they've had therapy in the past and they've had a negative experience. So in my approach, when I talk about solution focused brief therapy, even with couples, right? We don't need a year of couples counseling. I explain to them that we're only going to meet for as much as we need to solve the problem. So I'm not going to keep you one session longer than that.
Okay.
And and if one person is coming in, even though they're reluctant, they've taken a big step. They've agreed to come in, so they've already bought in a little bit, a tiny bit.
Yeah, yeah,
Fine,
a
I'll
little
go this
bit.
month. I'll go with you. Let's see what this is about. They bought in a little bit, right? So I celebrate those small breakthroughs. You're here. You didn't have to
There
be
you
here.
go.
But I will ask each of them individually, then together, what are their best hopes for our work together?
Mhm.
What do they want to get out of this? And in fact, on an even smaller level, I always say to my clients, what do we have to accomplish today in this session for you to feel like it was a good use of your time? So that
Mm,
way, so they've told me that on the front end, in the beginning of the sessions, I know if I can accomplish this thing today in this session, they will say it was successful. Not that it was
mhm.
easy, but it was successful. I got what I was hoping to get from this first initial session, and it brings them back. And at other times, it's just kind of forecasting how many times we're going to meet. I know you
Mhm.
say you don't want. I know you say you don't want to come in. I know you're thinking about divorce, but you're here. How about we both commit to 4 sessions? We don't talk about divorce. We don't talk about separating. But for 4 sessions, we just commit, and then we'll reevaluate at the end of 4 sessions to see what's next. So if they guys
Mm,
buy into those through 4 and really give it a good try, their honest effort, then we'll see where we're at. Because couples may separate, right? They may both
mm,
decide, you know what, this is not appropriate. This is not the best situation. But they're not. It's not going to be for a lack of trying.
mhm. Do you offer couple counseling before the commitment, before the marriage, as well, or?
Yeah, so a lot of people who are dating or engaged will reach out and they say, "Hey, something has come up," or they may say, "We want some premarital counseling. There's no identified
Awesome.
problem, but we want to make sure that we're good to go." which is perfect. And I said even better, even better. Before there's a major issue, sounds great. Before you're married, even better because a lot of change happens when you get married. Even if you're living together, when you get married, then things really begin to change, mentally, emotionally. So I think having someone, a third party, to kind of help them figure out how things are going to change and how we are going to kind of be prepared for that change and not lose sight of the relationship.
Yes. Now, it's 2024 and mental health and the profession has been around for a very long time, but we still have this stigma here in 2020. Why is it that we can't get to a place where it doesn't seem like the boogeyman? Why are we still having people be uncomfortable, uneasy with mental health?
All right. Well, I will say, there has been a great improvement, right? Because mental health is now being brought into the school at a very young age. So
Mhm.
now, as more generations age, they realize that it's a normal part of health.
Right.
I think part of that is because mental health field has become much more like the classical sciences, where there's more data, there's
Mm,
research, there's empirical evidence. It's not just, well, this just must be because I think it is. No, there's actually a lot of research to support some of these
awesome.
techniques. So it's really the empirically based support that is the reason why insurance companies pay for it because they know, okay, this is actually leading towards something. But I think it's going to take a lot of work from parents, and I will say in particular, the African American community. It's still a
Hmm.
stigma. There's
Yeah.
still a stigma for seeking mental health treatment, um, and I think part of it is just the idea that you know I always say this, when you go into your doctor and you're gonna get a physical, you're kind of embarrassed, right? Or you have an
Right.
embarrassing thing you want to talk about, and it's your medical doctor, it's private, but you're still really embarrassed. I would almost say our inner thoughts are more embarrassing than any physical thing that may be
Mm,
happening with us. Talk about being naked,
gotcha.
truly being naked is having someone listen to you.
Yeah,
So so things that we may bring up or begin to address in counseling, it's very scary because once it's out, you can feel like, oh my God, I'm exposed and I can't really
that
put it back in.
vulnerability. Yeah,
Right.
yeah. You just mentioned health insurance, and here in America, one of the things that we really have not we're struggling with is to make sure all of our citizens are covered with health insurance. So, for the individual who is saying, I think I need to go see somebody, but I don't have health insurance, are there avenues or ways for them to get the services in a way that they might not have the
Right.
funds for?
Right. I know, no, right now in America, if someone is underinsured or or has low income and can't afford, there is Medicare, Medicaid that supports.
Okay.
There's different state level, insurance companies like in Massachusetts is Mass Health. So there are, low income insurance
Awesome.
options. I think the struggle is when it comes to like, government or public subsidized insurance is that, a lot of clinicians or therapists, they don't accept it because their reimbursement rates are lower than private insurances, which makes it tough.
Oh,
So you have a smaller pool of therapists to seek out. And also, you know, now because of technology, there are different apps like, what's it called? Oh my God, I'm blanking. So there are therapy related apps that through text, through your phone, through email to get some support, and it's like a flat rate, like $40 a
oh,
month.
okay.
Like therapy Talkspace or
Okay,
Headway,
got
all
you.
these, all
I
the
think it was
other, yeah,
better help,
BetterHelp.
better.
That's the one I was
Okay,
thinking about.
okay,
Yeah,
okay.
yeah. So there's mixed reviews about how good that is because again, through text is not the same thing as seeing someone, but it makes it affordable. But really, I think that the right now, so much money is being poured into the mental health field, and all insurances will cover some mental health support.
Okay. Now, a lot of money is being poured into mental health field, and one of the issues that we're seeing play out across cities in the United States is police force are trying to incorporate mental health professionals in answering calls, certain calls that they receive. Would that be a mental health counselor? What type of individual would that be that would be answering these calls?
So some communities are really forward thinking and being able to bring in licensed clinicians. There's licensed mental
Okay.
health counselor, a licensed social worker. So they're licensed clinicians with experience. And to certain calls, because the majority of police calls are domestic issues, and though those are also the most dangerous calls police will often get. If it's a situation where the scene is safe, but there has been a commotion, very often having a therapist there can help people figure out where
Okay.
to go from here. Either it's finding a shelter or whether it is de-escalating, either making a referral, but also is informing, some of our officers as to, what we're seeing. What we're seeing in front of you is not someone
Uh,
who is trying to get into a fight. This person is in a mental health crisis and they do need help. So I think it just gives a glimpse. And thankfully, a lot of police forces have a lot of training themselves as part of the training, their yearly training on recognizing signs of, mental decompensation and how to deal with that.
okay. And our young people need you too. Are you now finding space in school systems too, where they have somebody on staff to deal with mental health crisis? Is that now being explored?
Yeah, so it's amazing how, staffing is tough on all these fields, and schools are also struggling with staffing, even having school psychologists. So now what you see a lot, I used to see in Massachusetts, is school districts are partnering with mental health agencies. And what they're doing is bringing them into a school, and that the school provides an office space in the school.
Great.
Now the agency puts the therapist in the school in an office. Now when the students come for therapy, get signed up with the parents, they're being paid by the child's insurance. So
Great.
the school's not funding or paying this person besides offering this office space, but now they're able to see a therapist in the school, because one of the tough parts for kids seeing therapists is transportation to the office.
Hmm.
They are squished into the golden hours from 2 p.m. to 6 p.m. after school. But now when therapists are in the school, they can be seen, at 9 a.m. or 8 a.m., right in the school building itself, makes it a lot easier. So it increases access. I think that's a really great cost saving by school, just provides the space, and
Yeah.
therapists come in and plant themselves in the school.
Awesome setup. Awesome setup. Yeah, because so much has shifted from I mean, the kids need it. It's just
Mm-hmm.
so much pressure. So let me ask you this: for the individual who might want to pursue psychology as a career path, and because you are a professor, what would you suggest? What would you suggest? What tips would you give so that they set themselves up to have a successful career in psychology? What would you say?
Absolutely. So psychology and social work are one of the most popular undergraduate degrees in college, right?
Oh,
A lot of, and not everyone will go pursue a master's degree and become a therapist, but very often people will have a degree in psychology or a minor in psychology. And I always try and recruit my students to continue on and become therapists, because we need more people.
yeah.
Um, it's really, one, you have to wrap your head around, that it's gonna take some schooling, right? At minimum, bachelor's degree and a master's degree. So at minimum 6 years.
Okay.
Um, but I think something that's really important for people to have longevity in the field, not get burnt out, not to quit and leave the field, is to understand that, our own mental health is extremely important. And while you're in school, begin the positive, healthy habits that's going to be important for you to sustain yourself as you are listening and talking to people in like the worst moments of their lives. So you really need to kind of be prepared for that. And if you can get a part-time job somewhere in the mental health field, at a psych hospital, at a camp, at a school, in some way be connected to other people. Because so much of counseling and psychology is just being able to relate to other people and being able to actively listen and be present for them. So doing that in any way possible as you're in school, whether it's working as a camp counselor, that's great. You're learning,
Oh,
you're interacting with people, working as a teacher's aide, just be working with people. I think it's a hard shift if you are working, at a factory and you're filling boxes, and then you
yeah.
graduate to a master's degree, and now you're going into the therapy field. It's gonna
Very
be
true.
that's a hard shift. That's a hard shift. So begin talking with people, begin, being a part of other people's lives, learning to communicate effectively is important, because it's a tough field and it is high burnout. So
Yeah.
if you don't begin the habits now, it's going to be really hard to sustain yourself when you hear some really devastating and
Yeah.
traumatizing stories.
Yeah. So after a week of having us sit on your couch and you taking notes and hearing all of our issues, what do you do to defrag?
Absolutely. So, I do love to run. I run 5Ks. I ran from middle school, high school, I ran in college, and now I
Bless your
run.
heart.
I still run so many 5Ks per year, maybe 10 to 20, depending on what year it is. Running is big for me. I do enjoy spending a lot of time with my family. And then, people say I'm joking when I say this, that I love my job, the plural, but my jobs. I enjoy what I do. So whether it's looking up, some studies or different approaches to help a particular problem I know my client has. I said, hey, that was a tough session. Let me go do some research and see, what has been effective or what tools I can bring for them. So I do like the work that I do. I don't dread Mondays. Mondays are my favorite day of the week,
Oh,
People think I'm joking still. I said, no, I'm not. I love what I do. Life's too short. Not life's too short to not enjoy what you do. So I try to find pleasure in everything that I do. Maybe the only thing I don't find pleasure in is, you know, walking the dog when it's raining outside. That's about it. But I try to
That's
find
a,
pleasure in everything else.
oh, great, great. Well, let me switch real quick to the other role, the other hat that you wear. You are a father. And one of the things that at least my grandmother told me that we should be, each generation should do better than the past generation.
Mm,
So, how do you impart mental well being into your children to let them know how to have the optimal mental health that they should have?
right. Well, first I would say I was blessed to have both my parents in my life, my
Hmm.
entire life. You know,
Hmm.
they're married. They're still married today. They are retired and still
Awesome.
married. And I'm the middle of seven kids. So there were
Oh,
seven of us. You know, but
oh,
it was
wow. Busy
looking back now.
house.
Yeah, looking back now, it was a zoo. But in the moment, it was so much fun and it was
Yeah.
loving. And both the parents were nurses, so being in the medical field, being nurses, they're
Oh,
already very empathetic. You know, they
yeah.
already knew how important mental health was. And my dad was one of the deacons at my church as well. My mom
Oh,
taught Sunday school at church, so they're
oh,
very much in tune with
oh, you had a good
communicating.
setup. Okay.
Yeah, yeah. So it is. I realized very quickly it was a blessing once I got to college how
Yeah,
not many people have that. You know,
true.
so for my family and my kids, you know, having an open conversation about emotions and making it typical, the normal part of their vocabulary from a young age is important. You know, I'll ask them, you know, not just don't do that. I would say, why did you do that? You know, and so I'm saying,
Hmm.
don't do that. You know, don't leave the milk again, or don't hit your brother. I'll say, why did you do that? And to get them to begin to think as to what the motivations are, and maybe there might be other ways of addressing their drives or their wants or their needs. So it's making that a typical part of our conversation and being open in general about everything else too, about
Hmm.
biology, about their bodies, about what's changes, about their friends.
Beautiful.
But you know, they're still kids, and my oldest is 14, so she's still a teenager, and you
Well, that's
know,
about to come.
no, no amount of it's already come. I know no amount of
I'm gonna pray
preparation.
for you. Okay.
Yes, thank you. I appreciate that. Because I fear that I've prepared them too much and they could turn it around on me because now they
Mm.
know too much. You know,
Dad, come sit down here. Let's talk, Dad.
right, right.
So, what would you say being a father has taught you about yourself?
It's definitely taught me that I am not the center of the universe, which I think that happens to everybody. Once they see the first child, to say, "Oh, I get it now. It's not
Hmm.
about me. It's about this little bundle of joy."
Hmm.
So I think that was huge for me in particular,
Awesome.
being the middle child and all the issues that come with being a middle child, fighting for their attention in a house of seven kids.
Yeah.
I realized that I'm not. It's not all about me. I can
Mm.
chill out and stop and focus on someone else. So I had I had my daughter when I was young. I was 21. We had my
Hmm.
daughter. So very quickly, in the midst of graduate school, going into graduate school, I learned that I am not the center of the universe. And
Oh,
you know, from that point, everything I did was really not for me, but for them. Yeah.
awesome. Awesome. I'm sure they're very proud of Dad. I'm pretty sure they are. Alrighty. Well, let me ask you my random question. Well, somebody who says they need somebody to talk to instead of venting to their friends over coffee, how would you suggest they go about finding somebody? Because I mean, when you look, there's just it's just so many, it's overwhelming. So how would you go suggest they go about finding somebody?
Right. So, you know, Google still is an option. You Google and your zip code, right? You can see who's
Okay.
nearby. Another great way to find a therapist that are accepting people, because a lot of them have full caseloads and not accepting new patients, is going to Psychology Today. I think that's the most, you know, widely used, you know, listing site for therapists, psychologists, social workers, couples counselors,
Okay.
psychologytoday.com. You put in your zip code, it'll show you a profile, the picture, their approach to therapy, any specialties they may have, any languages, what insurances they take, and also if they are currently accepting clients. I think that's just the easiest way. Um, if a child is looking for a counselor, talking to their school guidance counselor or someone in school, they usually have pretty extensive referral list of therapists.
Okay.
So it's out there. It's just really finding the ones that are currently accepting clients.
Okay. You mentioned child. Now we talked earlier about the dynamics of couple counseling. where usually one wants to go and the other one doesn't want it. So a lot of times when it comes to children, it's the parent bringing the child into therapy. Does that work well, or is there some friction there?
There's always friction there. And I think, for
Mhm.
kids or for teenagers, parents or schools or a doctor may realize that this child needs some help and they'll
Mhm.
sign them up for therapy. And they're usually the first session is like this. Child sits there and quiet, you know. And then, I still have my belief that, this child is not enjoying life right now. They're unhappy. Something's going on. It's not well. Everyone is
Mhm.
seeing this, so not being stubborn or difficult. They're just unhappy right now.
Mhm.
So I try to still use the approach where it's like, what do you're stuck here for an hour, so am I, or your mom wants you to come here, what do we have to do in order for this to be a good use of your time? And if they
Mhm.
say, well, I just don't ever want to come back, I don't want to be here, I don't want to be in therapy, what do we have to work on and accomplish for your mom to no longer feel, or the school to no longer feel that you
Yeah.
need therapy? you
Okay.
know so I really meet them where they're at. If they say I don't want to come back, say cool, then we need to do some hard work so you can be done and not have to come back.
Mm.
And we set those goals, and then we hopefully reach that, and then they can either they can end therapy because they have worked out some stuff, or they may say, oh, I still want to come back, or I want to see you once a month just for maintenance, kind of just checking in.
Is it a difficult transition when you're working with a child and you're kind of getting the understanding that this is a family problem and this is not going to be fixed unless I talk to a larger, is it difficult
Yeah,
to make that transition?
it's not. I think at some point we realized, when I was a young therapist, new therapist, is that all child therapy is really one. First of all child therapy is pretty much play therapy to an extent, but all child therapy really is also family therapy,
Hmm.
because seeing somebody once a week for an hour a week, does nothing when they're going back to the same environment or
Yeah.
situation that has led or created this problem. So you have to bring in the caregivers, whether it's family, whether it's the school, whether it is an older sibling, but really realizing who has the most time and influence in this child's life, they have to be a part of the process because they're the ones that's going to reinforce what you're working on in session. Like, hey,
Yeah.
me and little Johnny, we worked on how to deal with the anger and using slow deep breathing and counting. So when you see little Johnny angry, I want you to suggest, hey, remember you and Carter, you guys talked about counting, taking slow deep breath. We need someone to reinforce and to remind them that they have the skills.
Awesome. Okay. I like that. Yeah. Because I was just thinking it takes a team. It takes a team. But let me ask you this random question because otherwise I will talk to you for the rest of the day and you've got other things. You got the babies at home. So let's see what we got here. Let's see what we got here. I don't know. Maybe the kids will be better at answering this one. How many days past the expiration date before you throw out the milk?
Ooh, milk doesn't last in my house.
I was getting ready to say
That's
because
what I drink. They drink it for breakfast, for lunch, for dinner. Constantly
you buy
running through
two
the
at a
milk.
time or
Oh, no, no, I do by two at a time. Actually, yes, yes. So they run through it. But for me, I would say,
it doesn't even
maybe
last even.
it doesn't even last. But I would say maybe a day after. But it would never last. It never lasts.
Okay. Okay. Awesome. Okay. Now I know that there are nationwide requirements. Are you able to provide services across the United States or only in Massachusetts?
I'm able to provide services in Massachusetts and virtually in Florida. Right. But there is a accounting compact that's going through a bunch of states and trying to create some easy reciprocity where if you're licensed in one state, you can see anybody in other states. Right now, there's 21 states or so who are in that compact. Massachusetts is not yet a part of that, but hopefully that it becomes easier in the future. It increases access because you know the number of therapists, for example, in California can't treat all the people in California who need help. So there is a nationwide need.
And then, at sometimes, a person in California might be saying that Mr. Grant resonates with me more than what I have here in California. So, I mean, it would be optimal to have that option. Well, sir, tell us how we connect with you, and because you have blog and you're on Psychology
Yeah,
Today, people can read and everything. So tell us how we connect with you.
yeah. So obviously on Psychology Today, you can look up, Karter Grant. I'm in East Longmeadow, Massachusetts, but of course I serve the whole state of Massachusetts virtually where possible. You can find me on my website, libertascounseling.com. I'm the only practitioner in my practice, and I like it that way because while I do many different things, again, I'm able to really be flexible and pivot in what people might need. I've seen people at 6 a.m. before, if they're a very busy person or busy couple. I've seen people really early, seen them on weekends. Um, Also, I'm on social media, Karter K. Grant, TikTok, Instagram, Facebook, LinkedIn. I'm all over the place. Put me in Google, you'll find me. And then I love hearing from people when they say, "Hey, I would love to hear about how to address this issue," or
Right.
comment, "Hey, I've had this experience with therapy," or "How do I find a therapist?" You
Okay.
know, I have no problem reaching out, emailing, and commenting on social media as well.
Awesome. Awesome. So, does it look like one of the young ones will be following in Dad's footsteps?
Um, Not yet. Not yet. Not yet. My oldest is going to high school next year in the fall, and I'm just trying to wrap my head around that, and we're
Okay.
picking out all of her courses and what she's gonna
Right.
do. She wants to get into running, so that's good. So following my footsteps as a
That
runner,
way.
but we'll see where she goes from there in terms of
Awesome,
career.
awesome, awesome. She's got some good input, or any of them have some good input, so they would make great following in Dad's footsteps. Well, sir, I thank you so much for your time today. I thank you
Welcome.
for the work that you're doing, keeping us mentally grounded because the world seems to really, really need that at this point in time. Just everywhere you turn, it's a struggle for many of us. So
Right.
you are needed.
Absolutely, thank you. And I will just say, I just to impart again, my worldview is that people are inherently growth seeking, and at any given moment, I assume that everybody is doing the best they can with what they have,
Yes.
and they can do a whole lot more with the right support. So I think
Yeah.
people should take that home that they have within them the abilities and the solutions in the exception to the problem. When the problem isn't there, you're doing something right, and figure
Yes.
out what that is.
You just need a good cheerleader, a good coach from time to time. So, there's
Exactly.
Mr. Grant. Put me in, coach. Put me in, coach. All
Yes.
right. That is all for this week's episode of The Male Perspective. I'm your host, Lana Reid, and I will see everybody next time.